Hello, my name is Dr. Jennifer Beckerman, and I am a third-year hematology oncology fellow, and this is...
Hi, my name is Karan Jatwani. I'm one of the physicians at George Washington Cancer Center. I specialize in genitourinary oncology, so I take care of patients who have prostate, bladder, kidney, testicular, and penile cancers. And I'm delighted to do this video on testicular cancer patient education with Dr. Jennifer Beckerman, who is a fellow with me in the clinic. And I'm glad to have you here. Jennifer, I'll let you take it from here.
Great. So to lay the foundation, it's really important to understand the normal male anatomy. So the testicles are two oval-shaped structures located below the penis in a sac of loose skin called the scrotum. One of their functions includes the production of testosterone, which is the male sex hormone. Production is regulated by the brain, which sends hormonal signals to the testes. Specifically, the pituitary gland secretes both luteinizing hormone, or LH, and follicle stimulating hormone, or FSH, that regulate testosterone sperm production. Now, as you can see in this image, at the top of the testis, the epididymis and the spermatic cord attach. The epididymis is where sperm matures before it travels through the vas deferens and mixes with fluid from the seminal vesicles and the prostate glands. Now, who gets testicular cancer? Well, this is a graph that was made from the SEER database, which shows that the incidence has been increasing since the 2000s, particularly increasing in the younger age population among 15 and 39-year-olds, with the average age of diagnosis being at 33. Now you see, while the incidence is rising in all racial and ethnic groups in the US and worldwide, Hispanic individuals are projected to have the highest rates of all groups by the year of 2026. So, what is the prevalence and what are some risk factors for testicular cancer? So in 2022, it was estimated that over 309,000 men in the United States had a diagnosis of testicular cancer. And this translates into a lifetime risk for men developing testicular cancer of approximately 0.4%. Common risk factors include cryptorchidism, which is when the testicle fails to move into the scrotum before birth, a family and personal history of testicular cancer, Klinefelter syndrome, environmental factors such as exposures in utero and in early life, particularly endocrine disrupting chemicals, as well as a diagnosis of HIV/AIDS, carcinoma in situ, and cannabis. And this is based on a systemic review and meta-analysis that was published in 2015. So, what are the signs and symptoms of testicular cancer? Well, most testicular tumors are initially diagnosed due to the presence of a painless firm mass in the testis. A physician may perform an exam and then order an ultrasound of the testicle, which is a non-invasive imaging technique. Additionally, your doctor may order blood tests that we will talk about in more detail a little bit later. According to the U.S. Preventative Services Task Force, although most cases of testicular cancer are discovered accidentally by patients or their partners, there is really inadequate evidence that supports screening by clinicians and patients by self-exams. It has not been found to have a higher yield or greater accuracy for detecting testicular cancer at an earlier stage.